So here we have a wonderful panel who are going to share some of their perspectives and comments on this campaign and the programme for the decade of the European Specialist Nurse. So I'm delighted we have Kajsa Imanin from the European Patients Forum. She's the Director of Policy there. We have Nico de Kock, who is the Pedagogic Director and Senior Healthcare Manager and a nurse from the anesthesia sector, and Danielle Lewelt, who is the academic lead in nursing, but particularly working at the ICN, I think, if I got the information correct. So you can give us perhaps some perspectives. We just announced this big campaign. You've heard where it came from. It started in 2020 with great pride, the Year of the Nurse. Then the pandemic happened and there was a lot of clapping and nurses were put under incredible pressure. And there's a recognition that particularly within nursing, the role of the specialist nurse is not well understood. It's not equivalent in different countries. It's not appropriately recognized. And at this critical time where we heard from Maya that 15 out of the 29 countries who, in their national reports identified a lack of healthcare workers as a key challenge, this is the moment to make the case about what is a specialist nurse, what do they contribute, what could they do in terms of leadership and partnerships. So let's hear from you, your comments on this campaign and how you see this campaign might help you achieve your own objectives, how it would have an impact in the work that you're doing. Kasia, can I start with you from the patient's perspective?
Yes, of course. Thank you so much, Tamsin, for the introduction, and thank you to Bear and Esno team for inviting me to contribute today. Since I'm here speaking on behalf of the European Patients Forum, which is an umbrella patient organization comprising almost 80 member organizations across Europe, many of them disease advocacy organizations, we know, our community knows very well the value of specialist nurses. I think because I probably don't have very much time, I'm not going to dwell on the pandemic experience. Obviously, it was very, very hard, and nurses have been playing a key role, and in many cases, like Bear said, doing things they really shouldn't have to do. And I think now, when we are emerging slowly, I hope, from the pandemic, we think that some serious attention will need to be paid now to improving the healthcare systems and really thinking beyond the pandemic, because we have seen so many issues brought to the fore during the pandemic that in terms of inequalities, lack of access, the effect of delaying care to patients that actually, and the lack of patient-centeredness and patient involvement that we already knew already before the pandemic. It's just that the pandemic happened and brought these issues into the forefront somehow. And obviously we need to look at more fundamental changes in the healthcare systems in order to truly become, that they truly become patient-centered, person and people-centered as well. And clearly a health workforce that is well-trained, resourced, and with people who have the right skills, the knowledge and the attitudes to deliver this kind of care is extremely important. And I think we also need to consider, maybe reconsider the traditional roles and tasks. There was a presentation earlier on task shifting, so that the knowledge and skills of all the professionals can be used in the most meaningful and effective way to deliver care that delivers what patients need. And of course, nurses are often seen by patients as the one professional group that is very close to them, the people who see up close what they experience. And patients do tend to see nurses as important providers of information, important professionals with whom they can spend more time, perhaps, than with medical doctors, and really ask questions and get support on the daily care. So as we are now talking also about shifting care closer to the patient, being less disease-centered, more personal, more holistic, and more community-based, I think the specialist nurse's role will inevitably increase in importance. And of course, all the professionals will have to work more across professional borders. I don't have to repeat the importance of the specialist nurse in different contexts like disease management programs, rehabilitation, palliative care, self-management support, and contributing to the accessibility of healthcare services. We have taken good note of what has been said today, but also already before, there has been quite a bit of research that found that certain tasks trained nurses could take over from doctors, with the overall quality of care being equally high and patient outcomes being equally good. And indeed, in some cases, not surprisingly, patients were more satisfied with nurse-led care. And this includes also prescribing, where some studies have found that patients adhere better and again have better satisfaction with similar outcomes overall. So from our perspective, given that there is a growing demand, especially for chronic care and complex care, if things can be done more efficiently, whilst always keeping the safety and quality of care and patient safety rather, at the heart of it, this would be very welcome. And I think here, when we discuss about health workforce policies, there should always be a patient perspective in these discussions. It was funny to hear that someone mentioned that nurses are often on the menu, but not at the table when it comes to policy making. And we found that this is very often true for patients too, particularly when it comes to health workforce policy. This is an area where patients' views have not really been invited at European level. There are other contexts, of course, where collaborations are ongoing, but I think in EU health policy, we need to drive a change in future. And I can see several areas of collaboration where we can work with specialist nurses on this kind of policy advocacy. For example, considering patient involvement in the continuing professional education and training of nurses, something we are currently in EPF looking at with specialist doctors, and it would be a very natural continuum to also talk to nurses and see how we can collaborate and gain learnings also from existing projects that we know have been done by patient and nurse organizations in different disease areas. And another very important one, in my opinion, would be to explore the digital transformation, because this is affecting all the aspects of care and the patient's journey, but also how patients interact with different professionals, the roles, and how we relate to each other as human beings. So it might be very interesting to explore the patient-nurse relationship in this light, given that both of our groups are among the end users of digital solutions who are often not involved early enough in co-designing the tools. And of course, from my personal perspective, and I'll stop here, would be I would love to work together on patient safety advocacy, because this is such an important area, and at European level, it's a bit neglected at the moment. But there are initiatives ongoing also with the WHO European region. So patients have a lot to contribute, families have a lot to contribute, and nurses also. So we could work together in that, I'm sure. Thank you.
Thank you very much. And so it's very clear there's areas of shared advocacy. Both patients and nurses' voices tend to be underweight in policy discussions at European and national level. And there's an opportunity to share, particularly because of the close relationship, as you've said, the partnership between nurses and patients. Nico, let me bring you in now. And I wonder if you want to comment on what Maya said at the beginning, because Maya said, good news, I've got good news. I've announced a funding call, and there'll be a funding call for proposals on continuous professional education. And it was a part of me that was thinking, oh, that sounds great. It's really exciting. And then I remembered that when I asked Bear which of the 5 pillars was the most important for the campaign, he said, getting proper recognition in all European countries that there is such a thing as specialist nurses. So yes, it's great. There's a potential funding call, but until we've got the statutory change and a recognition of these specialist nurses, that to me sounds like there's a contradictory message there. On the one hand, yes, they want to fund some activities around training, but unless that training leads into a recognized advanced or specialist nurses position, then we've got a gap. What's your perspective?
Mm-hmm. Yes, thank you very much. Thank you to all the speakers for their high quality presentations, first of all. I think I noted I had also a double feeling about that. It was really these words that I put it on my paper, because if you see, we have some congresses in the past few years. We had COVID as a catalyst of specialist nurse positioning, about awareness about the complexity of care, and that's 2 elements. If you see them, you always these same elements are coming back. and we don't go further about policy, about strategy. How can we, what the presentation of task shifting, I see the same thing in France. The presentation about certification, I see it also on a national level. I think we have really to go further, because at the moment we have an increased awareness of this complexity needed, recognized in caring by specialist nurses. But at the moment, we can get at a break point if we don't go further in a recognition by policymakers on a higher micro environment. We can have a reverse adverse strategy, and so we can lose all attractivity about how can we put this complexity in an educational program that leads to something that gives a specialist nurse or an advanced nurse this recognition to say, I'm in this whole healthcare system, I have found a place on a regulatory base. And that's really important, I think. And we need really to go further. In this year, we talk about a decade. It's, for me, we have to really to boost this whole process of recognition at a European level, and take all energy and synergy and partnership. The EU are talking about partnership. It's really important to use also these guidelines that Corinne cited about ISN. It's something new. It's very recent. We have this publication with Esno that also will be something that underlines this whole system that are barriers for recognition. And so we have to use it and really stick together to upgrade it into a strategy for in Europe.
Thank you, Nico. And as you say, I mean, the education has to fit into a broader context.
Mm-hmm.
So if we're developing educational pathways that lead to new qualifications, those qualifications also then need to be applied. So there needs to be space within healthcare systems for new levels of practice, but also in decision making, in planning of healthcare systems, in allocation of resources, in developing new guidelines. So I think you're making the point that yes, education paths are great, but what do those paths then lead to? And I think that's an extremely interesting question. I'm about to pass to Daniela, and then I'm going to invite questions from the floor. We had a question earlier that I'm not sure that we're qualified to answer, which is about, do you think European countries also need to improve the e-hospital system for nursing as other non-developed countries? So I've recognized that we've had that question, but I'm not sure how we fit that into the conversation that we're having now. So, but I do invite you to put your questions about the campaign, about the decade, about what you might want to achieve, put it in the Q&A, and I'll invite the panel to speak on it in a minute. Daniela, let me bring you in now, and you've got a perspective that's more global. You've heard a little bit about what we're planning to do in Europe. Also, at the same time, at global level, there's been a lot of excitement about healthcare workers. We've had the year of the nurse and the midwife. That triggered here in Europe an understanding that we need to do more to explain what are specialist nurses, what's their contribution, what's their possibility, and then how health systems address this. Can you give us a sense of how this fits into what you're seeing at global level?
Sure, yeah, thank you very much for the introduction there, and thanks the Esno team and Bear for the invitation. Is it okay if I share my slides there for one second?
Go ahead.
I just have a few slides, I won't keep you long. Let me just see if I can manage this. Yes, should be here. So yes, my name is Daniela Lewald, and I'm the chair of the International Council of Nurses, Nurse Practitioner, Advanced Practice Nurse Network. In my voluntary capacity, and I suppose the confusion at the beginning, we all have a day job, and I guess my day job is an academic leader in nursing in Dublin City University in Ireland. I'm native German, and I'm residing in Ireland, so Europe is obviously close at my heart all the time, although we're working globally with ICN. Just wanted to give a brief snapshot of the European trends and challenges with regards to advanced practice nursing for today. No, Yes, so we heard a little bit about this. The ICN guidelines give kind of trying to provide some common understanding with regards to advanced practice nursing. And in the guidelines, the advanced practice nursing is described as an umbrella term that focuses on the two main roles in relation to advanced practice nursing. There are many more, but just focusing on the two, there are clinical nurse specialists who are experts, clinical advisors, and consultants who are they're basing their care on established diagnosis on patients who are already diagnosed in a specialized field of practice. And they're also engaged in patient education and systems education across staff within various healthcare systems. And nurse practitioners, who are different advanced practice nurses, I suppose, who are really kind of creating this bridge between nursing and medicine. They integrate clinical skills associated with nursing and medicine in order to assess, diagnose, and manage patients in various healthcare settings, often without the need for a physician to be present there. So just wanted to highlight that as a definition, but it has come up already. The guidelines, if you haven't read them already, I would certainly recommend it. They're available in English, French, and Spanish, and the link is down there at the bottom. Yeah, so internationally, I suppose you can see down the left the map. Within the network, we have representation from all these countries that are highlighted there in red. And as you may know, advanced practice nursing developed within the English-speaking countries first, comes from the United States of America, Canada, Australia, New Zealand, UK, and Ireland. And within Europe, the English-speaking countries and generally, I suppose, globally, are the ones who have the advanced practice nursing role mostly established probably very well. And I suppose within Europe, also the Netherlands. However, there's a global spread, but depending on where you find yourself within the world, you will find that advanced practice nursing is developed at different stages of development. So you might find yourself somewhere in an English-speaking country where advanced practice nursing is very well established, and then you might find yourself in another country where advanced practice nursing is developing or it may be thought about to develop. So within Europe, we do have a lack of nurses, as we know from within the network, from our members and from our research that we're carrying out, that there's a lack of nurses that are fully practicing at nurse practitioner, advanced practice nursing level with an expanded clinical decision-making authority in direct patient care. So these people are not managers, they're not educators, these are clinical practitioners working at a level beyond the general nurse and the specialist nurse, at clinical nurse specialist or nurse practitioner level. And they need the authority to provide care without the presence of a physician and be able to prescribe, order and evaluate tests, diagnostic tests, physically assess, diagnose and treat patients, admit and discharge, and to exactly what Kaiser was just saying there, to provide timely care for patients. That's the main point. It's about patient care, reducing patient waiting lists, running smooth services and effective services, and provide patient-centered care, which results in higher levels of patient satisfaction. And if you think, what's this woman talking about? These roles do exist. So if you wanted to look it up, I guess in terms of getting some examples, within Ireland, we have these profiles of advanced nurse and midwife practitioners and clinical nurse and midwife specialists, and they give good case examples of what these nurses actually do and where, what specialist areas they're in. So in terms of a wish list, what we would like to see over the next decade, we would love to see more clinical nurse specialists and nurse practitioners and other advanced nursing roles within Europe being developed, and they need to be designated and protected roles, and those roles that nurses can fully function in and at a full capacity. And that requires regulation. So we do, and we have heard that before today, so I'm not saying anything new there. We need to legalize nurses' authority to prescribe medications, diagnose and treat patients. We do need title protection for the nurses in advanced nursing roles. And with that comes pay scales. I do make the point that they also need to be paid at an advanced level, and that's very important, and that needs to be done. And we certainly have achieved that within Ireland. And education is, I think, the key to all of that, I suppose. It's that kind of what Bear was talking about, that campaign is so important for this, because whereas like I worked as a nurse practitioner, I know what the role is, and I'm involved in this for over 20 years. But a lot of the time within our healthcare colleagues, it's advanced nursing what, you know, so the understanding isn't quite there. So we actually need to educate ourselves, our colleagues, the public, very important, policymakers, the hospital managers, and the health insurance systems as well. So there's a lot of things that we need to do. We need to be much, much louder. This has been a quiet revolution so far, and I think we need to get loud about that. So that's what I would wish for. And there are master's programs all across Europe, as far as I'm aware, for advanced practice nursing, but I do think we could review them and maybe shape them up a little bit, in particular with regard to the clinical placements and with regards to clinical competency parts within the programs. So just to mention, if anybody's interested, we have a conference going on in Dublin, in Ireland. If you'd like to come over, hopefully COVID will permit us to have this in person, 21st to 24th of August, 2022. The links are down there below. And there's also the membership list, and here are the references. So thanks very much. Just wanted to
thank you.
On that.
Thank you for that, Daniela. And of course, your slides will be shared with everyone as part of the material, so they'll be able to see that and the information about your conference. Let me pick up a couple of questions that we've received from the audience. And we've had a question that I think is probably going to end up going to Nico. We've had a question from Siv Staffseth, who says the master's degrees is decided by the Bologna process for specialist nurses. Is this still the policy of Esno, that you want to have the master's degree for specialist nurses should be part of the Bologna process? Nico, is that something you can answer?
Yes, thank you. So the master's degree, I think, will be at a level of advanced nurses, and the specialist nurse is between a general nurse, the level between. So I think as was shown in the slide with certification, the master's degree is needed if we will have recognition for an advanced level. That will be the condition to get into an advanced level recognition for nurses. And beyond, we will have a whole space for specialist nurses that can also have this professional educational evolution.
Thank you. And I noticed just on this point, we've had a comment in the chat from Christine, who's saying that perhaps we need to make a difference between specialist nurse and the clinical nurse specialist, an APN. Yes. Because, you know, one might needs to have a master's level, but for a specialist nurse, a post-bachelor degree is enough. And that's a message from Christine. And I see Daniela's nodding. Karina, I know you wanted to come in and you've got a question for Daniela. So let me pass the microphone to you.
Thank you very much, Daniela. And I believe you were part of the team on ICN to develop this, yes. So I'm going to ask the right question. I hope I asked the right person the question. So, I mean, when I was looking through the document, what was interesting was that unlike previous sort of documents and research, the emphasis on the shortage of doctors was not evident. And I have like a direct query about this, you know, because I believe, wrongly or rightly, it's my hypothesis, that the development, especially of NPs, nurse practitioners, is directly related to the lack of doctors in the place.
Okay.
And
yeah.
Sorry. And in Malta, let us say, we don't have that. We don't have the evidence that we have a shortage of doctors. So even talking about prescription in such countries like Malta will put their backs up. Unlike, you know, areas like specialist nurses and their development in skills and all that, that I think will happen and will continue. What's your thoughts about this issue of the development?
Yeah, thank you very much, Corinne. This is a brilliant, but they are brilliant questions. And I think you're right, like traditionally, when the role, particularly of the nurse practitioner, started to develop, it was really based, and it was the same in Ireland, based on the kind of shortage of doctors, quite often in specific areas, maybe in the community or in rural areas, you know. So, and that's where nurses kind of stepped in and said, well, look, you know, maybe we can kind of bridge that gap, and they did that, and that's how it kind of all started. At this point, I suppose in terms of prescribing, what I would say is, it's not as if, and I think when we talk about task shifting, it has to be just understood that we're not talking about, you know, maybe nurse prescribing to become something that just the nurses do then, you know. There's actually enough work for all of us. You know, from my experience, I would say it never ends, actually. It gets better, and that's the good thing, you know. So actually, if nurses and doctors can prescribe, and in Ireland, actually, some pharmacists can prescribe, and in the UK, there's others who can prescribe too. So it's just to improve the patient experience. If the patient needs a painkiller, needs it now, if the nurse is there and she has prescribing rights, she can do that. She doesn't have to wait for the surgeon coming back from theatre at 6 o'clock in the evening. It can be done then, and that's the timely element of it. So that's, I suppose, more what we talk about nowadays. But I think, yes, you're right. There are, and still, you know, if we have shortages of doctors in certain areas, quite often we see nurses slotting in there and actually, you know, bridging that gap. So that's how it develops quite often. Yeah.
Thank you very much. And we've got just 3 minutes left in this session. And what I'd like to do is I'll ask each of our panelists that just, you know, in 1 minute, we're seeing with this campaign, Esno is being very bold, and it's stepping out of just looking at issues related to nursing, but actually picking up on the broader issue of health system reform, looking at leadership, decisions about the way things are done, and also encouraging nurses and specialist nurses to be more open in their storytelling, to sort of really come front and center. If there's one message that you'd like to share with the nurses, specialist nurses who are making this bold step, a word of encouragement, what you'd like to say to we want to build the momentum. This is the beginning of a 10-year process. What would you like to share as your message?
I can start.
Go ahead, Daniela. Thank you.
Thank you. I would say to anybody's practicing out there, I know that you have lots of experience. You're out there in your area and you know it 100%. I know that. I'm an ICU nurse by background myself, so I know you know your stuff. So what you need to do in terms of leadership is think about, you know, what could be done better, and you know what can be done better, but take that and try to push the boundaries. Try to get that done, and you can lead that. You're the nurse, you can lead it. You need support, but you can do that. And I think that's what we need to do.
Thank you. Nico.
I would like to underline the value of a human being, to be a professional and to be there for caring professionals, patients, and that we have our own professional creativity to confront and to take care of the patients, even we are in a difficult and complex situation.
Thank you. Kasia, go ahead. Last message to the patients.
Sure. Well, I think it's a great campaign, and stories can be really powerful. So go ahead and tell your stories. And I think you have an ally in our community, because our community knows the value of a specialist nurse is probably much better than the average person will know. So also get in touch maybe with our organizations and see if we can help spread the message.
That's excellent. And I want to say a warm thank you to our panelists for sharing this. And I'm now going to hand over to Bert, who's going to give us the last section.